Have you ever come home after a long day and noticed that your cat is simply nowhere to be found? Not on the couch, not by the window, not in any of their usual spots. And when you finally locate them, they're tucked deep under the bed or hidden inside a closet, staring at you with wide, still eyes. Most people assume their cat is just being a cat, independent, mysterious, a little dramatic. But I need you to consider something else, because that behavior might be telling you something critical about your cat's emotional and physical well-being. Hi, I'm Larissa. I'm a veterinarian, and today I'm going to talk about something that doesn't get nearly enough attention in the world of feline health: chronic stress in cats. And one of the most important things I've learned in clinical practice is that stress in cats is rarely obvious. It communicates through the body, through behavior, through the smallest and most easily dismissed changes in daily routine. I'm going to walk you through 7 specific signs your cat might be showing you right now that signal chronic stress. Signs that most owners overlook completely. If you have a cat at home, whether they're young, senior, indoor, or outdoor, this content is for you. Stay with me until the end, because what I'm about to share could genuinely change the way you see your cat. And that change in perspective could protect their health in ways you haven't yet imagined. Let me start by talking about what stress actually is in the context of feline biology, because understanding the mechanism is what allows you to recognize the signs, and that recognition is everything. When we talk about stress in cats, we're talking about a physiological and psychological state triggered by the activation of the hypothalamic pituitary adrenal axis, called the HPA axis in scientific literature. Think of it as the body's internal alarm system. When a cat perceives a threat, whether that's a stranger entering the house, an unfamiliar sound, another animal, a change in furniture placement, or even a new scent, the brain sends a cascade of signals that results in the release of cortisol and adrenaline. In small, short-lived doses, this response is completely healthy. It's the fight-or-flight mechanism that has kept felids alive for millions of years. But when the stressor doesn't go away, when the perceived threat is persistent, chronic, or unpredictable, the system stays activated. The body never gets the signal that it's safe. That is when we enter the territory of chronic stress, and that is where real physiological damage begins. Here is something that makes this particularly complicated in cats. They are remarkably efficient at concealing their emotional state. This isn't stubbornness or aloofness, it's evolution. As both predator and prey in the wild, showing vulnerability could be fatal. So cats internalize. They adapt their behavior in subtle ways. They keep functioning, right up until the point where the body begins to break down. This is exactly what makes chronic stress in cats so dangerous and so consistently underdiagnosed in clinical settings. Research has established that stress is a significant contributing factor in some of the most common health problems we see in domestic cats. A landmark body of work by Buffington and colleagues demonstrated a direct relationship between psychosocial stress and feline idiopathic cystitis, a painful inflammatory condition of the bladder, showing that environmental stressors played a causal role in triggering clinical episodes, independent of anatomical factors. The ISFM and AAFP Feline Environmental Needs Guidelines, published by Ellis and colleagues, further highlight that indoor cats are particularly vulnerable, given that their environment is entirely controlled by humans and rarely meets their full behavioral, spatial, and sensory needs. The cats most at risk include those living in multi-cat households where social tension exists, cats who have experienced recent changes in their environment, a move, a new baby, construction, a new pet, cats with limited access to vertical space and hiding options, and cats whose daily routine is unpredictable or inconsistent. Individual temperament also plays a role, and early life experiences during the sensitive socialization window, roughly 2 to 7 weeks of age, can permanently shape how a cat's nervous system responds to perceived threats throughout their entire life. Now I want to explain the biological mechanism behind the most visible and misunderstood behavioral sign that brings this topic to people's attention: hiding. The technical umbrella for this is cryptic behavior, and it's one of the most consistent indicators of psychological distress in the feline species. But I want you to understand what is actually happening inside the body when a cat retreats and conceals themselves. When the HPA axis is chronically activated, cortisol levels remain elevated for extended periods. Prolonged high cortisol suppresses immune function, disrupts gastrointestinal motility, increases cardiovascular load, and, critically, alters the behavioral landscape. The brain, persistently saturated with stress hormones, shifts into a sustained defensive mode. Social withdrawal, reduced exploratory behavior, heightened vigilance, and active concealment are all direct behavioral expressions of this physiological state. The cat is not trying to be difficult. The cat's nervous system is trying to protect them from a threat that, to their perception, has not resolved. This is why hiding, while it may appear to the human eye as simple introversion or preference for privacy, functions in clinical practice as a meaningful behavioral red flag. However, and I need to be very clear about this, hiding behavior is not exclusively caused by psychological stress. It is also one of the earliest and most reliable signals of physical illness and pain. A cat who is nauseated hides. A cat with an infection hides. A cat experiencing internal pain hides. This is precisely why I never attribute a behavioral change to stress alone without first ruling out an underlying medical cause. Any cat showing new or increasing hiding behavior warrants a complete physical examination and a baseline diagnostic workup before we draw any conclusions about psychological stress as the driver. It's also important to understand that several medical conditions can mimic stress-related behavior so convincingly that even experienced clinicians are initially misled. Hyperthyroidism in older cats, for example, can present with anxiety-like hyperreactivity, increased vocalization, and apparent restlessness, all signs that overlap directly with stress. Urinary tract infections can cause litter box avoidance that looks behaviorally identical to stress-induced elimination changes. Pain from arthritis, dental disease, or gastrointestinal issues can produce social withdrawal that reads as depression or chronic anxiety. My clinical approach is always to treat the whole patient. Behavior is biology, and biology is behavior. They cannot be cleanly separated, and responsible care requires that we investigate both simultaneously. Now I want to walk you through the 7 signs that I observe in clinical practice, the behavioral signals that, taken individually, might be dismissed as personality quirks, but together form a recognizable and diagnostically significant pattern of chronic feline stress. The first sign is hiding or increased social withdrawal. I've already discussed the mechanism behind this in depth, but it bears repeating as a standalone clinical warning. A cat who begins spending significantly more time in enclosed, dark, or elevated hiding spots, under beds, inside closets, behind appliances, in boxes, is communicating a state of heightened arousal or fear. If this is new behavior and it persists beyond 1 to 2 days without an obvious and resolved trigger, it warrants clinical attention. The second sign is changes in litter box behavior. This is one of the most distressing signs for cat owners because it disrupts daily life in very visible ways. A chronically stressed cat may begin urinating outside the litter box, defecate in inappropriate locations, or spray urine on vertical surfaces. Research by Pryor and colleagues has established that stress is a major trigger for inappropriate elimination, particularly in cats with an underlying predisposition to feline idiopathic cystitis. When you observe this, the litter box itself is rarely the problem. The environment is the problem. The third sign is excessive grooming or, conversely, grooming neglect. Both extremes signal dysregulation of a normally stable behavior. Overgrooming, medically described as psychogenic alopecia, occurs when a cat engages in repetitive, compulsive, self-directed licking as a coping strategy for anxiety. The results are visible: symmetrical hair loss patches, most commonly on the belly, inner thighs, and flanks. Undergrooming produces a dull, matted, or unkempt coat and may indicate that the cat has moved beyond the acute anxious phase into a more withdrawn, depressive state. Both presentations deserve a veterinary evaluation. The fourth sign is altered appetite. Either a meaningful reduction in food intake or, less commonly, stress-induced hyperphagia, compulsive eating, can occur. Cortisol directly disrupts appetite regulation pathways, and a cat who was previously enthusiastic at mealtimes but now leaves food consistently untouched for more than 24 to 48 hours, needs to be assessed. Don't wait. Hepatic lipidosis, fatty liver disease, can develop in cats with reduced food intake in a matter of days, particularly in overweight individuals. The fifth sign is increased vocalization. Stressed cats may vocalize substantially more than their baseline, yowling, howling, or persistent meowing that appears unprompted, particularly at night. While increased vocalization in senior cats also requires evaluation for cognitive dysfunction syndrome and hyperthyroidism, in younger cats without a medical explanation, persistent unexplained vocalization is a credible expression of anxiety, disorientation, and emotional distress. The sixth sign is aggression. Whether directed toward other animals in the household, toward people, or manifesting as redirected aggression, where a cat becomes aggressive toward a safe, available target after being exposed to an external trigger they cannot access or confront directly. Redirected aggression is particularly confusing for owners because the aggressive episode seems to come from nowhere. Understanding that the cat perceived a threat, perhaps a cat visible through a window, or an unfamiliar scent on clothing, and could not respond to it directly, is essential for interpreting and safely managing this behavior. The seventh sign is excessive scratching and urine marking. Scratching is a normal, necessary feline behavior. It maintains claw integrity and serves as both visual and olfactory territorial communication. But its intensity and frequency can escalate dramatically under chronic stress. A cat who feels insecure in their territory will scratch more as a means of reasserting boundary control. Similarly, vertical urine spraying, which is a distinct behavior from inappropriate elimination, intensifies when a cat's perception of territorial security is compromised. Together, these 7 signs can constitute what behavioral medicine researchers describe as a chronic stress syndrome in the domestic cat. The Cat Stress Score, developed by Kessler and Turner and published in 1997, is a standardized observational instrument used by veterinarians and researchers to quantitatively assess stress intensity based on body posture and behavioral indicators. I use its principles in consultations as a structured framework to help owners see and understand what I observe when I watch their cat move through space and interact with their environment. Understanding the signs is a powerful first step, but recognizing them in your cat only becomes clinically meaningful if you know what to do next, and that process starts with a thorough veterinary evaluation. Let me walk you through what a responsible diagnostic workup looks like when behavioral change or suspected stress is the presenting concern, because the conversation you have with your veterinarian and what you ask for genuinely matters. The foundation of any feline behavioral assessment is the systematic exclusion of medical causes. This means a complete physical examination, a CBC, complete blood count, and a full biochemistry panel that evaluates organ function, including liver enzymes, kidney values, and thyroid markers. Hyperthyroidism in particular can mimic anxiety-related stress with such precision that the two are regularly confused in practice, especially in cats over 8 years of age. A urinalysis, including urine-specific gravity and sediment evaluation, is also essential, particularly when litter box changes are part of the clinical picture. From the behavioral medicine perspective, one of the most clinically valuable tools available is the Cat Stress Score, developed by Kessler and Turner. This instrument assigns a numeric value to observable body postures and behavioral states, ranging from fully relaxed to maximally tense, and provides a structured and reproducible way to assess stress intensity across time and environments. While originally developed for research settings, its principles are directly applicable in clinical consultation and can help owners document changes between veterinary visits. For cases where environmental stress is confirmed as the primary driver, the AAFP and ISFM Feline Environmental Needs Guidelines provide a clear, evidence-based framework for identifying and correcting the environmental deficiencies most likely responsible for the stress burden. These guidelines describe 5 foundational pillars of a healthy feline environment: provision of safe resources, opportunities to engage in natural behaviors, positive, predictable, and consistent social interactions, a safe physical environment with access to appropriate stimulation, and respect for the individual cat's sensory preferences and thresholds. When I conduct a home environment assessment, either through a structured questionnaire or a direct consultation, these 5 pillars are my starting framework. In complex cases, especially where aggression is involved or where behavioral interventions alone have been insufficient, referral to a board-certified veterinary behaviorist is not only appropriate but strongly recommended. Veterinary behavioral medicine is a recognized specialty, and outcomes with integrated behavioral and pharmacological intervention are significantly more robust than environmental management alone. The American Association of Feline Practitioners recommends annual wellness visits for adult cats under 10 years of age and biannual visits for senior cats. I would add to this that a behavioral assessment, not just a physical one, should be part of every wellness visit. Ask your veterinarian specifically about your cat's stress levels. That question opens a conversation that can change outcomes. Now, I want to be honest with you about something, because honesty is the most important thing I can offer you in a conversation like this. Managing chronic stress in cats is not resolved by a single product or a single adjustment. It isn't a matter of moving the litter box 2 feet to the left and watching everything normalize. Feline stress management is a multimodal process, and it requires consistency over time. But the genuinely good news is that the evidence base for the tools we have is strong, and most of the most meaningful interventions are things you can begin implementing immediately. The first and most foundational pillar is environmental enrichment. This means giving your cat more of what their biology genuinely requires: vertical space for climbing and observation, multiple enclosed hiding options, opportunities to engage in natural predatory behaviors through structured interactive play, and access to resources, food, water, litter boxes, resting zones, that are not contested or competed over in multi-cat households. The clinical rule of thumb I apply in practice is N+1. The number of each key resource should exceed the number of cats in the home by 1. 2 cats means 3 litter boxes, 3 feeding stations, 3 water sources, positioned in separate locations. This single adjustment reduces inter-cat resource competition, which is one of the most under-recognized and under-addressed sources of chronic stress in multi-cat homes. The second pillar is synthetic pheromone therapy. Synthetic feline facial pheromones, available in plug-in diffuser format, have been studied as a non-pharmacological support tool for reducing stress-related behaviors in cats. Research by Pajot and Gaultier, and subsequently by multiple independent groups, demonstrated that these pheromone analogs can meaningfully reduce hiding behavior, inter-cat tension, and urine marking. They are not a standalone solution, and they do not replace environmental modification, but as part of a broader management plan, they represent a safe and accessible first-line supportive intervention. The third pillar, in cases where behavioral and environmental interventions are not sufficient, is pharmacological support. Anxiolytic medications, anti-anxiety agents prescribed by a veterinarian following a complete clinical assessment, can be appropriate for moderate to severe stress, where quality of life is demonstrably affected. I want to be unambiguous about this. These are prescription medications with species-specific pharmacological profiles. The hepatic metabolism of cats differs fundamentally from that of dogs and humans, and this affects both drug selection and dosing. Medications that are safe and effective in other species can be hepatotoxic or fatal in cats. This is never something to approximate from human or canine medicine. It is always something to discuss with and receive from a licensed veterinarian. The fourth pillar, and the one most likely to produce durable change, is behavioral modification with a veterinary behaviorist. Systematic desensitization and counter-conditioning applied consistently over weeks to months can genuinely restructure a cat's emotional response to their triggers. It requires patience. The outcomes support the investment. I want to be straightforward about something before I close. You cannot prevent all stress in your cat's life. Life changes, families grow, routines shift, people move, and some stressors are simply beyond our control. But there is a significant amount you can do, starting today, to build a more resilient, secure, and behaviorally healthy environment for your cat. The most immediate and cost-effective action you can take is to evaluate your home through your cat's eyes. Does your cat have access to elevated resting platforms, cat trees, wall shelves, secure window perches, from which they can observe the room from a position of advantage? Do they have at least one fully enclosed, dark, undisturbed hiding spot available in every room they use regularly? Are their resources, food, water, litter box, positioned away from high traffic areas, away from loud appliances, and away from each other? These structural adjustments are among the highest impact environmental interventions available to us, and most of them require nothing more than thoughtful rearrangement and a small investment in vertical furniture. The next action I need you to take is this. Never give your cat any human medication without explicit veterinary guidance, and I mean never. Human anxiolytics, sedatives, antihistamines, and painkillers are not safely transferable to cats. Diazepam, for example, while occasionally used in feline medicine, requires precise veterinary dosing and liver function monitoring because it carries a documented risk of idiosyncratic hepatic necrosis in cats. And beyond behavioral medications, common over-the-counter human analgesics, including acetaminophen and ibuprofen, are acutely and severely toxic to cats. Acetaminophen, at doses that would be entirely safe for an adult human, can cause methemoglobinemia and fatal liver failure in cats within hours. No level of stress or behavioral concern justifies that risk. One pill can kill. Please keep all human medications out of reach and out of consideration for your cat. Also consider the stabilizing role of routine. Cats are neurologically calibrated for predictability. Consistent feeding times, scheduled play sessions, and reliable patterns of human interaction are profoundly calming for the feline nervous system. If significant household changes are anticipated, a move, a new pet, a new family member, begin making gradual, incremental environmental adjustments several weeks in advance to reduce the abruptness of transition. Introduce new scents, sounds, and objects slowly. Give your cat time and control. And finally, put your cat's annual veterinary visit on the calendar today if it isn't already there. A behavioral conversation belongs at every wellness appointment. I know that watching a video like this and recognizing some of these signs in your own cat can feel unsettling. It's never easy to consider that the animal who seems perfectly fine lounging in a patch of sunlight might be carrying a level of chronic stress you weren't aware of. And I want you to know, that is not a failure on your part. Most of us were never taught to read feline body language. Cats are experts at concealing what they feel, and our culture has spent decades romanticizing their independence in a way that made it easy to overlook their needs. But now you have the vocabulary. The hiding, the litter box changes, the grooming shifts, the appetite fluctuations, the unexpected aggression, the excessive scratching, the change in voice. These are not random. These are not personality quirks. They are communication. Your cat is speaking to you in the only language they have, and now you know how to listen. So here's what I want you to do right now. If you recognized any of these signs in your cat, make a veterinary appointment. Not someday, soon. Bring a written list of what you've observed and when it started. Ask for a behavioral assessment alongside the physical exam. Ask about the cat stress score. Ask about environmental enrichment. Start that conversation. And if this video gave you something useful, please share it. There is a cat in someone's life right now who is struggling, and their person simply hasn't had the information yet. This could be what changes that. Tell me in the comments, did you recognize any of these 7 signs in your cat? Which one surprised you most? I read every comment and I genuinely want to hear from you. I'm Larissa. Take good care of your cat and take good care of yourself too. See you in the next video.